Yeah, I'm just trying to keep open, but no, it's still 9:50. 9:50. But I feel weird. I just feel like once the technology is going, you like cross the major hurdle of the meeting, right? You know, you're like, everybody can see me, everybody can hear me.
Right, well,
Well, it looks like there's food on the waiting room up there. I'm putting this out.
Oh. What do you click on it? Yeah. That's all. Thank you.
We do tend to look for. You have secrets.
okay. We'll call the Jackson County Health Department Tuesday, March 21st, 2023. Board meeting to order here. Roll call, I'm Christian Becker.
I'm Gerald Bybee.
Jennifer Warren.
Elizabeth Townsend.
Do you usually have this?
No, normally I don't know why we did that, but go ahead.
Okay.
You guys can just say who you are and then we can say fast.
All right, so I have a motion for approval of the minutes for our last meeting.
I'll make a motion.
All right, it's been moved and seconded to approve by Dr. Bybee and by Ms. Davenport. All in favor?
Aye.
All opposed? All right. Any citizen comments? Seeing none, we'll go on to our agency presentations. So, got the Scott County Health Department here. If you guys
All
want
right,
to take the
yeah,
floor.
for sure. So my name is Amy Thorson. I'm the director of the Scott County Health Department. I've been with Scott County for 24 years, kind of grew up there and have been the director for the last 2 years. I have two of my managers with me, so I'll let you two introduce yourself real quick.
Sure, I'm Brianna Boswell. I'm the family health manager. So I supervise our programs related to maternal health, child health, iSmile, and the child care nurse consulting positions. And this is the first year that we've been operating in Jackson County. So I'm happy to be here and just wanting to give you a little bit of a report.
Hi, I'm Andy Swartz. I'm the environmental health manager for Scott County Health Department. I've been here a year. Prior to that, I worked in Illinois for 11 plus years. So it's been a pretty good learning experience this year in the state. So in Scott County, we do food, water, sewage, pools, tattoos, tanning, core programs. And then we have contracts with Clinton County, Jackson County, and Muscatine County to do pools and tattoo inspections for those.
So just a little bit, not sure where that is. Vibrating. It's, I'm trying to figure out who's my purse. Apparently I'm not able to not be distracted. So as Andy and Brianna shared, we've recently started providing services in Jackson County. The state of Iowa had asked us last fiscal year if we would take over the tattoo and swimming pool inspections for the county. And then this last spring, so starting October, we were awarded the maternal health and child health RFP for collaborative service area 14. And so we wanted to come here and introduce ourselves. We have the same regional consultant, Becky, and so she can tell you the real scoop about all of us. Hopefully it's a like good thing. But really want to make sure that we're introducing ourselves, we're hearing your needs. How can we provide you information about the services that we're offering in your community? What do you have that are concerns that we can factor into some of the work that we're doing? You know, we really feel like we want to be part of the table. We've had other agencies provide service in Scott County, and that didn't always go well. And so we don't want to be that entity. We want to be part of your community and your efforts. So Brianna can tell you a little bit about what we've been up to with our maternal health and child health program. We actually work a little bit with Genesis VNA in that, and had really hoped to be able to partner a little bit more, but the funding that came from the state didn't really allow us to do much subcontracting and have either agency be able to meet the requirements of the grant. So I'll ask her to just share a little bit, and then Andy can talk to you about just the number of facilities you have. And we by contract need to make sure we provide you a report. So we'll do that once the fiscal year is over, but certainly are open to more opportunities coming to talk with you, or if you want to have a written report. Each of the board runs a little bit different, and so we want to make sure that we're getting you what you're used to, or even more than what you were used to. So please tell us, because we do things a little different in each of the counties. So I'll stop talking and let Brianna give you a little bit of heads up.
All right, so like Amy mentioned, we are part of Collaborative Service Area 14, which includes Cedar, Clinton, Jackson, and Scott counties in that region. And so I think I see my partners from WIC up on the screen there too. So Cynthia and Maddie is, I believe, from CHC WIC, as long as that's the right Maddie R that I know, joining us today. And so they also are in collaborative service area. So this has affected the maternal child health programs, the WIC programs, and a few others as well. And so I'm here to tell you a little bit about what's been going on with maternal health and with child health. So for maternal health, we are currently offering services, including dental screenings and enhanced services to pregnant and postpartum women at the WIC clinic here in Maquoketa. And so that's our first activity that we got started when this collaborative service area made the switch. In addition to that, we are reaching out to families that are newly enrolled for Iowa Medicaid in Jackson County. And so far we've served about 100 children that are newly enrolled since October in Jackson County and counting. So it looks like we've had anywhere, I think in the fall, we started with about maybe 33 families jumping on Medicaid per month. And then it's really eased up here after the holidays. We're running more like 12 or 15 families a month here that are newly enrolled. So just know that we're reaching out to them, making sure that they are linking up with doctors, dentists, that they know how to use their benefits, and are getting the things that they need. So that's a big piece of this outreach. We've provided 27 dental services to children here. A lot of those have been at the WIC clinics, but we also have a dental hygienist that is going into child care centers and schools as well with iSmile services and reaching out to families in that way. We kind of have a special partnership here that we have established about midpoint through the year with the ECIs. And that will extend that iSmile reach a little bit. That'll get us past kind of our iSmile priority populations and into the childcare a little bit more. Through iSmile, we need to make sure we're covering schools that are 40% free reduced lunch and greater. And then we've reached out to the Head Starts as well. So that helps us get into some of those other childcare centers. So we're happy about that partnership. We have a couple of families too that have received dental care coordination services, and we expect those numbers to grow. And we also do what's called presumptive Medicaid eligibility determinations. And so we've had one of those here in Jackson County too this year, and that's where we are able to fast track a Medicaid application and get that family same day coverage. So that, let's say, you know, Joey needs his mental health meds so he can stay in school. Coverage is expired or something's happened in the family's life and we need to get that going now. And that's a way that we can do that. And get kids, you know, functioning, sometimes with toothache, you know, some kind of immediate need that the child may have, that we would run a presumptive eligibility application. So that's kind of our services. I'll try not to talk too much more, but just give you a quick rundown of our staffing too, because I know sometimes it's hard to wrap your head around, you know, what is this thing that's coming to our area. We're currently employing 2 full-time dental hygienists. One serves as the iSmile coordinator, who's really at the desk quite a lot and doing a lot of community outreach and doing a lot of care coordination with families. The other one is a dental direct care focus. And so that one is out in the community in the childcare centers and schools doing a lot of screenings. So that's our main hygienist. We just recently in March added a couple per diems to give them a hand as needed. So we have some flexibility, we can expand as needed. We employ 1.5 nurses through our maternal program. And so we send those nurses primarily out to WIC clinics and a couple of OB-GYN clinics in Scott County. We had our eye on one here in Maquoketa as well, as the group kind of expanded into Maquoketa. We've had conversations, but they're not quite ready for us to jump in there with them, but just kind of know we're keeping our eyes peeled for you in that way. We also have a child and adolescent health outreach person, a Hawkeye outreach. So you may notice if you have businesses in the area or faith-based organizations, our Hawkeye outreach person is kind of moving through the area and making sure that everybody knows how to access those children's health insurance programs through the Hawkeye program. So if you ever have any questions about that or need people to show up at events, you know, we have the staffing for that. And then of course we have one CCNC that works primarily in Scott County. We subcontract, we were able to squeeze one little subcontract out here with Genesis VNA to have Chris McClyman, who's long been providing services, continue doing so as a CCNC here in Jackson County and Clinton. She's
one of my favorite CCNC.
Oh, right. If you're unfamiliar, I mean, it's childcare nurse consultants. So childcare nurse consultants provide guidance to childcare centers, helping them make sure that kids with special health care needs get the consultation services that they need, that environments are safe for kids to play in, and just really help the centers with their quality ratings too. If they want to be part of the state quality rating system, they'll provide that technical assistance to them. Been a very busy year for CCNCs. They have a new system out and they're busy training everybody on the med admin requirement, which is kind of new with that one. So that's a bit about CCNCs. Also through Genesis, I think it's worth noting, Lori Sparks is their child and adolescent health nurse. If you're familiar with her, that was another little piece of our subcontract that we were able to preserve. So she is still in WIC clinics in the area doing lead screenings, which we really would like to see continue, and happy for the work that she's doing. So with that, that's kind of a rundown of where we're at, and I'm happy to take any questions, or we can move to Andy and take questions in a minute.
You guys are doing a lot for us.
Happy to be here.
With you, not for you.
Yeah,
with you.
with you, right. Yeah.
Is there any way, do you guys have like pamphlets or anything like that? You can give like electronic ones that we can post on our website, or maybe we could talk about doing some sort of a you know, a link or some sort of joint something, just to make
Sure.
sure that people will get that information. and so that we
Absolutely.
can remember what you, you know, because I get a lot of calls in my office, people looking for services, and I wasn't even aware that some of these were being
Where do we
provided.
send them?
Yeah.
Yeah,
So,
yeah, I can send you some links to our web pages,
Okay.
and then I think we probably have brochures on there.
okay.
But if there's more that you want, I sure can do that.
I brought some just general Scott County Health Department brochures, but they're really for the whole department and not a ton of detail, just because nobody likes to read a ton of detail, but I'll leave some of those for all of you, as well as my business card, and we'll make sure that, yeah, however we can link, that would be great.
Yeah, I'll get those to you.
Thank you.
Okay, so as I mentioned, we do the pool inspections and the tattoo inspections for Jackson County amongst other counties and stuff. So in Jackson County, there's one tattoo facility, it's here in town. And then we have 5 swimming pools, 2 spas and a wading pool. So those spas are at places already. And then as is that wading pool. We have completed the inspections of all the pools, and tattoo, the one tattoo facility, here so far this year. Just waiting for the weather to get a little better, and then we can do the outdoor ones, which, there's one up in Bellevue, actually, no, 2 up in Bellevue Offshore Resort and, Bellevue Municipal Pool. Most of the inspections have gone well, had some issues at a few places. And stuff, so we're working with the owners on that. So in the environmental health division, there's the environmental health manager, which is myself. We have an office assistant, and then we have 7 inspectors. And of those 7 inspectors, 2 of them come up here to Jackson County to do the pool and the one tattoo facility inspection. So right now we have a little issue at the hotel pool, just kind of letting that kind of play out, I suppose. The owner's wife was expecting when we were there in December, so I'm assuming that's kind of delayed the reopening of that pool and stuff. But that's just kind of a rundown. It's kind of quick and stuff, but if you guys have any questions, please let me know.
The inspectors that come here are both very seasoned. One's been there over 40 years, another over 30 years. You know, the work Brianna talked about with her team has occurred really since January, because we had a whole new staffing for that program. We had some babies and people chose to stay home, and we had some new positions to add. And so things have been a little bit crazy as we moved into that October date. And so, but lots of people with experience and passion. Brianna actually herself started in the child health program as our first I Smile coordinator, originally at community healthcare, and then into the health department. And our philosophy from the department's perspective is that if someone else is doing something in the community, we want to partner with them. We don't want to duplicate services. And so, you know, that's important for us too, as we start to work at some of these events and be places where you are too, is how can we work with each other? So definitely not coming in looking for more business or things to do to recruit people to come to Scott County. That's not our mission. When we're here, we're representing Jackson County and your agencies. So,
And I think it's common for some bigger health departments out there to support the smaller ones.
yeah, this is relatively new for us. We have been doing the pool and tattoo in Clinton County for quite a few years, but the expansion to Jackson last year, and then we were asked to take on Muscatine County this year, was kind of a new thing for environmental. And for the rest of the department, this collaborative service area concept is pretty new. We've had enough business to keep us operating, and we're a pretty heavy funded Scott County tax dollar agency. And so, you know, those dollars we try to keep in town as well. So, yeah, it's sort of new for us, not new to others, but yeah, new to us. So we want to make sure we're doing it right and meeting the need.
Have you had to hire any additional staffing covering the other counties then, or?
From an environmental perspective, we didn't need to
Oh.
add any additional staff. From the maternal child health, that whole system has changed a little bit. The grant itself was very different than it had been in the past. So like the dental direct position that Brianna mentioned, that's a new position completely. And so that was added and we're doing things that we didn't do in the past. The per diem staff, I think we're an additional, like, we're gonna need a few extra hands to do some of this. And so we may continue to expand or look for other ways if we get to a point where we think, okay, there's enough revenue generated from direct care services to warrant some additional individuals that provide direct care, or there'd be a way we could shift some grant funds to expand, but we're still pretty new into what this looks like. And we did add an additional outreach position beyond what we had done. So for the informing person, we had 2 positions that kind of split those duties and did outreach as well. And now we have 1 person that's only focused on informing services. And then we added an additional outreach. So we still have 2 outreach people. So yes, but they're serving the whole service area, not specific to one county.
Full restructure, right?
Yeah,
Both at the state level and then made us do some of that too. To make it
been
happen.
interesting.
So, I think it's gonna keep being interesting for a while.
Yeah.
Yeah. Stay nimble.
Make appointments for, massages when your head whips the other direction and you, we were just working on, I'm sure with the budget changes and everything, the county amends our budget twice a year. So they just approved our mid-year amendment. And I just laughed because what we had anticipated for the maternal health and child health program and subcontract, we got none of it right. Everything's changed and the figures are all different. And so there was a lot of red, which means it was a change on our spreadsheet. And yep, the 8 ball wasn't right on that one. So it's changing.
Well, thank you for your service to Jackson County.
Yeah, and please let us know, what you'd like, if you want us to jump in on the calls when on your every other meeting, if you want us to send a report, if you just want us to come every once in a while, however that works best for you and what you're used to or what you need, we want to make sure we do that.
So generally, everybody submits a written report or at least
Okay.
comes and gives a report.
Okay,
I think, I don't know I don't want to speak on behalf of the board, but that's what we typically have been doing.
okay.
So I don't know.
Yeah, I don't know if you gotta come every meeting, but maybe quarterly and,
Okay.
or something, give an update. In person or something,
Yeah.
but send up your report.
So just an FYI, our stuff there could be a real lull in action and stuff like
Right.
that. So at least from the environmental health standpoint, may not have anything for 3 to 6 months sometimes. So because there's so few facilities
Right.
for our area
Yeah.
we're working in and stuff, so just
That's fine,
FYI.
just,
Yeah, just FYI.
And maybe, all 3 of them have to come in if it's just like,
Yeah.
I think even sometimes the staff person that could talk a little bit about a unique situation they encountered or something like
Right.
that, or a story, so we can work on kind of what a report might look like from us that captures both programs. It'll seem a little wonky just because they're so different, but it'll give you a flavor and we can try to come up with some unique things, or if you hear of things that are happening in your community that one thing we're seeing with tattoos a lot is microblading, that is considered a tattoo establishment. So we'll see that in beauty salons and things like that. So, you know, we can let you know if there's new facilities coming in and things like that as well.
We'll have a dental screening, record review report for you too. We have to submit that to the state the end of May. So probably come June, if you're warm to that, we probably would have some dental screening audit results for you.
Yeah, I know I was CC'd on some of those emails, but I was like, I
Okay.
wasn't sure what to do with that.
Sure, yeah, you can. We just
Okay.
kind of thought for the school dental screening requirement, we're actually carrying it out on behalf of local boards of health. So we just wanted you to be aware of what's happening.
Sure.
So as our smile coordinator goes out, I didn't bring the dates if anybody's curious. But they're coming up first week, basically of April, as far as local schools are concerned for their audit dates. So we'll have a report for you. It's kind of interesting, you know, how many dental screenings were done, how many had treatment needs and so on and so forth. So it gives you just a little bit of a snapshot of kind of how things are. Their dental health.
Well, and we didn't want to have local health directors surprised too if they got questions, because I think previous contractors might have done some things a little different or had the ability to do some things, more advanced screenings, to actually have the reports look better, things like that, that we just haven't had the capacity to do. And so if you got calls from, a school and are like, what in the world is Scott County coming in? Where, we just didn't want you to be surprised. At least it would have shared like, yeah, I think I got an email.
Thanks again, you guys.
Thank you.
So moving on, the ASAC, Julie Fern.
I know she's
Oh,
on.
I'm here. I'm here. I'm trying to figure out my computer, but I'm here. There we are. So greetings from Tampa. Wanted to just pop in and kind of go over my report because there's a couple interesting things going on. I believe it was in your packet. So the numbers for the program we're doing are really good. You guys can read those. I wanted to talk a little bit about our medication assisted treatment and that we've been working towards getting that available here in Jackson County. On December 30th, President Biden signed a bill called the Mainstreaming Addiction Treatment Bill, or the MAT bill. And what it did is remove the requirement for an X waiver for a prescriber to prescribe the medications of medication assisted treatment, buprenorphine. So we had been trying to get an X waivered provider here in Jackson County, and now that's kind of a moot point. So what we've kind of been talking about is that the provider, we have medical providers in Jackson County. I believe we've been trying to talk with them about their willingness to provide medication assisted treatment. And what we need is training for them on medication assisted treatment, since it's something they've never been able to do before. And Matt Osterhaus is connected to the University of Iowa College of Pharmacy, who is setting up some training, or that's their goal, for prescribers to do medication assisted treatment. So they were looking for, I believe, pilot counties. And I think Matt was trying to get us signed up to be one of those. Because then, we could have providers at the different offices across the county, and it would become accessible, more accessible to people, which really is our goal. So, it was interesting when that bill came through, we weren't expecting it. It was attached. It was on page 1062 of a debt ceiling bill. It was thrown in as a rider, but it did pass and it got signed. So December 30th, it went into effect. So some planning needs to be done now that the bill's already happened and it's in effect. So that'll be interesting. Hopefully, Matt was, I think June, either by June or in June, where they're hoping to have maybe some trainings organized. So we'll keep working on that. I lost you. Otherwise, we're continuing the programming we've always done. We did host an event in Preston last Thursday. I'm not sure if everyone's aware, but Preston has had some losses of both students and adults in the community, and it's been a real struggle for mental health wise. And so Jim Ott from Dubuque came down and did a whole program, has worked with the students and the staff about just helping kids deal with grief and loss. Substances, especially alcohol, seem to have become a coping mechanism for the kids. And so we really want to nip that in the bud and address it. So we're going to continue to work with the school. We're trying to get them into a resiliency zone project with Iowa State University. Would provide ongoing support. So we're working on that as well. Is there anything in the written report anybody had a question on? Okay, so those kind of the highlights. You know, a lot of what we do, we just keep doing it. We are killing it on tips trainings. Last year we had 48 people, I believe, for the whole year. We were at 73, and it's not even halfway through our grant year. So that is exciting. I think people are used to us. They know we're here, and now they're asking for trainings versus us having to go out and shake the tree and hope we find people who want to come to the trainings. So,
Julie, are you doing any more of them locally?
any more what locally?
Tips training?
Yep, I have one scheduled for March 28th. That one's for stores like gas stations, Walmarts, Fairways, those kind of places. And there's one in April for bars and restaurants. So we will keep doing them even though we reached the goal we had set for number of people and number of trainings. We'll just keep going.
All right, thank you.
All right, take care.
Have fun, stay warm.
All right, bye.
All right, next on the agenda is community health with Jennifer Warren.
Yes, I did my report and a couple of changes, so I'm just gonna kind of do a COVID report, probably already know all this, Dr. Biden, but as of April 1st, the Health and Human Services are no longer requiring mandatory COVID positive tests. So the tests have been kind of inaccurate because people are using all of like the Walmarts, Walgreens, fast tests. So we haven't had an accurate number. I know that we're in an upsweep right now. I think I talked to one of the nurses at your office that our numbers are going up, but as the CDC site, which I put in here, it was high, but they downgraded to low this week. So I don't know how accurate that is. I don't know. Another big thing that's going to be happening is May 11th. It's no longer the national emergency. So the orders for our vaccine for emergency situations will be null and void, but we'll still be able to give vaccines because the new order is going to come. I don't think it's going to be in an emergency order like we call it EAU. It's going to come in a different format. They'll start charging for some vaccines. People are going to take Medicare, primary insurance. I work through Genesis DNA, and we have on the back of my pamphlet, we have what clinics we're doing, and we don't charge. So we do 3 or 4 a month, and I think that that's going to maintain. We have one more big vaccine order. So before we have to start paying for it, and that's going to come up in the next month. So we're going to, I don't want to say stockpile, but we're going to try and get as much as we can so we can give it as free as people are coming in. Our numbers are definitely dwindling. But I have had a couple of people come in and start the whole series to get the vaccine, which is kind of neat. There's one change, Moderna, the prime doses, which means your first or second doses are no longer going to be available April 1st. If you want to get a booster, those will be available. I think they're just kind of starting to get ready for when the next booster comes out, whatever that is going to be. If it's going to be like a flu shot booster. I haven't had any word. I haven't heard anything or gotten emails or anything. Have you heard anything about it yet?
No.
No, it's been pretty quiet.
I just presumed that it was gonna blend and stop the original and.
Right. Pfizer
everything's gonna be
isn't,
the
Moderna is, but you can give the Moderna bivalent. So That's just kind of an FYI, and we will have orders and through Jax's VNA, Clinton and Jackson, we still give the boosters and whatnot free. We have a lot of people coming in that are over booster. So we really, I know, so I really look at their cards. I'm like, you've had 2 of these, you're good. So they're in a habit of coming in every couple months. I need another one. Nope, we're good until we hear what the next booster is. So we've been doing a lot of educating on that. So that's just kind of the COVID aspect. I am continuing to work on the community health needs assessment for Jackson County and the health improvement plan. And that is going to be due to the state in June. I have one more call where I have 3 committees in each area that we're working on, which is substance abuse, obesity, and brain health. And I have a call in a couple weeks, and hopefully people will get on and then we can kind of get data together and I can write this report up and then put it in. I work up closely with Julie, and we're really, one of our biggest goals was getting a medicated assisted treatment in Jackson County. And it looks like that's really going to happen. It's kind of exciting.
Just FYI, the official due date for Township to state is November 7th. So not
Oh,
maybe that's when you're gonna be due, putting it in. but just
Oh,
so
I'm
you know.
sorry. Okay, I was told by, okay, my boss said June.
I just didn't want Scott to be like, wait a minute, it's due in June. I thought it was.
Oh, sorry, okay, I have to have it done, so she gave me 2 days. Okay, so,
We're doing ours every 3 years with the
you're
hospital.
good.
So we're
oh,
good.
oh, got it, okay.
Oh,
We
yeah,
do
it's
ours
great.
every 5, and they changed some things up with the state, where we don't have to do as many goals, but they want 1 goals and a lot more objectives and a lot more strategies, so it'll be interesting. I'm learning first one, so. Okay, we do quite a few foot clinics in Jackson and Clinton County and Scott County and everywhere, it seems like, but according to our, there's gonna be some changes in starting in July where we have some staffing and due to decrease in funding. So like Macoka's clinic was 2 days a month. It's gonna be back to 1 day a month. We're gonna try and do 24 in a day. We'll see. But that's our plan. Same thing goes with Bellevue got closed, but we're trying to pull everybody into Macoka. It's just a lot of shifting. If anyone has any questions, I can go into exactly what we're doing. It's really staffing and then change in funding. We're really trying to change from doing one-on-one care to group care. So I'm doing more teaching. I did some teaching on what Jax's DNA does the other night. I'm doing something on home safety. A lot more things are coming in where I'm speaking. So I'm learning pretty quick. Okay. Another thing that we're working on is increasing our education on the social media platforms. And that's why I was asking you, Elizabeth, about this and integrating more groups work versus the one-on-one, trying to get more knowledgeable that way. I'm old, so it's not second nature like it is for my kids. Jackson County Prevention Coalition that Julie is in charge of, we received 2 really big awards in Washington, DC in December. Was it January, sorry, end of January into February. We got Coalition of the Year, which is actually, I'm pretty proud of it because we're a really, really small coalition in comparison to everybody else that made Coalition of the Year. We had people from Tampa won. I mean, all of them are very big industrial cities, where here we're just kind of little. And I really, really put that on Julie, because she's just phenomenal. And I know she's not on anymore. Phenomenal in being able to keep all of our things in order. So I just wanted to kind of give her kudos, because we also, I attended with her graduate coalition, and we were able to graduate with that. So we got 2 big awards at this conference. It was at the Gaylord. It was bigger than I thought it would be. So it was really neat. We did a lot of meeting of different coalitions and how they ran things, stuff like that. So that was neat. I am in emergency preparedness for Area 5, which covers 16 counties. We just did a radiation tabletop drill. And I'm revamping the point of dispensing plans right now with all of the knowledge that we got with COVID. and giving clinics and whatnot. We're kind of vamping them since we actually did it. And what's conceivable and what wasn't, so we're redoing that. And I was gonna talk about the Preston meeting that Jim on talked. So does anyone have any questions?
Thank you much. Thank you, Jennifer. So next on the agenda is Hillcrest Family Health Services, Cynthia Kaczynski, the WIC coordinator.
Hello, Cindy Kaczynski. I work for Hillcrest Family Services, and we are subcontracting with Community Healthcare out of Scott County to continue providing WIC services in Clinton and Jackson County. And I don't know, Maddie, do you want to turn your camera on? I want to introduce to you Maddie Ranshaw. Maybe she's not going to turn her camera on. She's the WIC coordinator out of Community Healthcare in Scott County. So that's who we report to with our services. I had sent in a written report. Did anybody have any questions on that? Okay, we keep plugging away, providing services. Sadly, numbers are still below where the state would like to see us. So anybody who can refer, please do. We have plenty of room to provide benefits to participants in Jackson County. Thanks.
Thank you very much. I guess, Elizabeth, you're up next with the environmental health report.
Sure. So our annual pumper inspections that we're contracted to do through the DNR, those are coming up due the middle of next month. So I've been working with the pumpers in our county. We have 4 of them. They have all not been compliant on keeping their records. So I was trying to think of the best way to go about this. So I work with the DNR. Basically, we're missing so many records that it's kind of too late to go backtrack, but to work with them moving forward to make sure that they're keeping records. So I did put a little like cheat sheet for them together. I gave them all a letter saying that they have 30 days to get back into compliance. Otherwise, they may not get their license renewed this year. So they've all actually just signed a little thing saying they acknowledge they're not in compliance, that they are going to review the code and that they are going to keep records, and that I'll do that review within 30 days. So everybody was pretty accepting about it. I thought we were going to have angry pumpers, but they were all admitting that they weren't probably doing what they should. So and then our grants to county claims, they're all submitted for our second quarter. They were submitted late just because the new system that's been put in place, it's been slow moving, and so I had to kind of wait for the state to get that up and running, but everything is submitted, so we're waiting to hear back on that. I recently put together an animal bite pamphlet for our rabies prevention program. Basically, it's something that I gave to law enforcement to hand out to bite victims, because typically they are the first responders to a bite incident. It's either our law enforcement, or if somebody goes into the hospital or see the physician, they'll usually report it too. So it's just kind of and I did an attachment, printed out kind of goofy, but it just kind of talks about, how to prevent rabies, what to do if you've been bit by an animal, who to contact. We've had some issues where people have euthanized a dog or a cat when maybe they shouldn't have yet. Because typically we like to be able to collect a specimen and send it into the state lab if necessary. Otherwise, we like to see that 10-day quarantine period happen before we would euthanize. So it's just to kind of get to people before I'm able to, so they have that information, because sometimes the law enforcement doesn't know what to do or what to say. So it's just kind of an easy piece for them to hand out. Let's see, and then we had a binding agreement for a future demolition for a home that was purchased a couple of years ago. So this would have been back when the previous administration was in place. So they were given a year to demo a building, basically a dwelling. And they came to me a year ago and asked for an extension so that they could go in and, you know, remove pieces of the house. So I did give them an extension, but they came up to the end of that second year. Nothing was done. I made a visit to the home site and clearly it's not a livable dwelling. I wouldn't even consider it a dwelling at that point. So instead of having this board take any action, it actually got sent over to the zoning office as a nuisance because it's just an eyesore. It's right on Highway 64 going out towards Sebula. So they are, I do know that, and I got an update today on it, that the gentleman that owns it is working on getting that tore down. So if you hear anything, that's kind of, but it was kind of a strange process because I wasn't really sure if it was action we would take or if it should be handed off, but because it wasn't even livable, I wasn't concerned about the septic system at that point. Nobody was gonna go in there and be able to live. I'm pretty sure they would fall to the floor. So. And then our Grantston County water testing program. So I just ran 2 ads, one in the Macokota paper and one in the Bellevue Herald and one in the. So they'll go for 2 weeks, just because now we're getting better weather and I can get out and do water testing. Whereas a few weeks ago, as you may know, the roads were terrible.
What roads?
You know, I just have to say, people say that the roads are bad here, but we've just had such strange weather. Everything just would thaw and then freeze again. And my little car, even though it's all-wheel drive, kind of had a hard time getting around. So I didn't push any water testing unless it needed to be done. But hopefully it will pick up again. Our testing numbers are still very comparable to Dubuque and Glenn County, so we aren't behind or anything like that. Let's see, and then our permits, so we're on track for permits this year. We did 33 water tests this year. We've got 5 well water reconstructions, 3 well permits, 3 septic permits, 1 soil analysis conducted by our department, and then we had 8 animal bite cases. And then as far as going paperless, we're about 80% right now paperless. The biggest thing is there's paper coming into me, so it's not going out, but it's coming in. And so that's just something that until I guess the county would do like some sort of a program where they could go on site and pay for a permit or on the website and pay. People are still just bringing paper in because they still have to bring a check anyway, so. But that's all I got.
That house on 64, is that well been plugged in?
So it's a farm location and the gentleman says he's doing stuff out there.
Okay.
So I'm kind of keeping an eye on it. But he says supposedly he's going to be using it. So if I don't see any activity, I mean, I've been out there, there was like tumbleweeds rolling through the place. If I don't see anything by the end of the summer, I'll probably approach him and have him plug that well.
Are there any animals or anything?
You know, I didn't want to enter into a trespassing thing because he was pretty upset. I mean, the lot goes back pretty far, and there's quite a few farm buildings in the back, but I don't believe at this time it's being used. So once he tears that house down, because that's right up on the road there, I should be able to go down and I'll probably actually go with the zoning office. We'll go down there together and take a look at things. So,
That's pretty much on her radar now, then really.
it is, if
Nuisance.
yeah, now if it had been a situation where the house was what I would consider livable, I would be, you know, we would be doing something about it instead of the zoning office. But at this point, it's so dilapidated that it's just, I think if anybody even went into the house, they would fall through the floor. I mean, there's trees growing out of the windows, so unless there's squatters there or something, but I don't think so. I mean, it's out in the country, so not too concerned.
All right. Thank you.
Mhm.
So moving on to unfinished business, there's Discussion and possible action regarding setbacks at 49197 Green Island Road and 49130 Green Island Road.
So I don't have any updates on this. I had sent emails to Mark and Matt a couple of times, but tomorrow Nan and I are actually gonna be going to the Iris Board meeting. I think they're still going there. So maybe it's something that we could get on the agenda for a discussion. I don't know why they haven't responded, but maybe their plates are full right now. So I don't know if it's still something the board wants to pursue or. And I know Sarah's kind of new to this, so there's some septic issues out in I guess septic issues out in Green Island. There was a home that was up for sale for quite some time, and the lot is too small for well and septic. And so they weren't able to sell it as a dwelling. And so then we did kind of a water study. I went out and tested as many homes, wells as we could. Not everybody wanted to participate in that. But for the most part, water tested good. And so our question was, do we want to look at putting a sewer system out in that area for those dwellings out there? So I don't know. It's probably doable, but we would need the help of the Iris Board to do something like that. So I'm guessing we still want to pursue it. Maybe, yep, okay. Leave it on the agenda then?
Yeah.
Okay.
Okay, moving on to new business, discussion and possible action to approve a newly proposed Jackson County Sanitarian conducted soil fee recommended by the County Board of Supervisors.
So I went before County Board of Supervisors to do our budget presentation. And this was after this board approved our budget. They approved everything, except the one thing they didn't like was the fee that we proposed or that we set in place for the soil analysis program that we're doing. The reasoning, and maybe Nan can jump in on this, but I think it was more of like an issue, well, a couple different things. One, they wanted to see us maybe purchase equipment in future that we could conduct the testing, and so whatever we would bring in a revenue would go towards that equipment. The other reason was that they were concerned of a liability with me crawling down into a 6-foot deep hole. Does that sound kind of like what?
Pretty much. I wasn't worried about it.
Yeah. I just did one today and I'm fine.
So, yeah, I mean, they talked about maybe upping the fee a little bit to kind of offset what maybe some future testing equipment could cost.
Yeah.
So that we don't always have to do the sending her down in the hole.
Right. So my only concern about upping the fee, because this board does set the fees. I mean, they've already approved the budget though, and that budget does have that $400 in it. So, for each soil analysis, so on a revenue end, but I mean, I already got called yesterday to go and do one. And the nice thing about it was that the contractor liked that I could do a permit on site. I mean, they dug a hole, I wrote up a permit. They were able to get the septic tank in today. They're gonna put the lines in later this week. So, I mean, it worked well. I don't know that everybody's gonna use it at that fee, but I do know that both of the other companies that are coming in are from quite a ways away. So, and I know one of them is getting close to retiring and he's the one that's closer by. So I think we'll just see how this year goes with it. I'm okay with the 400. But I wanted to bring it back to you guys.
Is the alternative to a trench a core, or what's the alternative? The equipment,
Yeah.
I assumed it wasn't gonna be a trencher if you don't want to be in a trench.
Right, so it would be, the guys that do it now, they have a pickup truck and they have a special coring equipment and they, drop it down and they pull out a core and it's a lot safer, I guess. I do know, I mean, I talked to, both of them, both of those different companies about the cost. I mean, it just depends, one of them had a custom machine made for his pickup truck, another one drove down to Alabama and picked up a machine and, paid, I think, $25,000 for it. So I figure by the time my county car is ready to bite the dust, maybe we'll be ready to purchase something with a new truck. So I think it would be beneficial. I think that, it's something that, I'm capable of doing and, it brings in revenue for, our program. And
Is this like a perk test or what is that?
so it's not a perk test, it's a soil analysis, and the only real, I mean, there's benefits, different benefits, but really the biggest benefit is that you can do it, you don't have to do it seasonally, you can more so do it anytime. You get a really good reading of what the soil is, although most of the soil we have out here is still loam. The only time that we're gonna run into something else is if we hit like rock. So it's fairly easy. It's not like extremely complex for us to, for me to pull up a soil core and look at it. So, and I've worked directly with some of the soil guys to do this, and they've been teaching me a lot, and I've taken some classes with the state, so.
Have you seen any sites rejected because of bad tests or?
Yeah, we get them, and we get them quite a bit, actually. We consider them not suitable. So then at that point, we look at an alternative system to install, which is
Like more clay soil or just?
yeah, usually if there's a heavy saturation, or you just don't have the, depth to limiting layer. I mean, there's a lot of different factors that contribute to it. So I don't know if we need to take action and to approve that fee, or because we already approved a different fee and it's different from what.
Might not hurt. Cover us.
Yeah, is there a motion to
So
approve?
what was the fee that we had?
What was it, $400?
So I think we said like $250, I think. Of course, it's been a while back. And then I went to the county board and they're like, nope, 400. So my only concern was that the contractor has to dig a trench for me to go into. And it's just I think it's just gonna be a preference among contractors. Like some of them might wanna go with us, some of them might wanna go with one of the other companies. I know one of the companies, people have to wait quite a while for them to come out, so. That's,
Maybe we could put the burden on them, have one of them take a pipe and put jigs in the back and the bottom like a saw and figure out how to either pound it or twist it to make their own cores and then push it out.
yeah.
They, one of them it seems like nothing's gonna be as simple as I think it's gonna be, but they could jury rig something for less than 20,000.
Yeah, well, and the thing is that the prices I know A&E, they're one of the bigger companies that comes out here, and they're starting to charge quite a bit. I mean, I think I don't know what they're around
They're about
600.
600 now.
Yeah, so they've gone up, so we are still less than what they are. It's just more, is the contractor gonna be available to dig a hole? And like I said, I mean, when we get busy and when these contractors are busy, a lot of the time they'll just be like, yeah, I've got a backhoe here, can you come out, and they'll dig a hole. So I think we might have a better outcome than what I'm originally was thinking, because I was concerned about it at first.
Well, and I think that was kind of some of their thinking, like, one, safety issue, will it deter somebody? It might, blah, blah, blah. And two, you're gonna be more on demand for it, more readily available. Why not capitalize on that?
Mhm.
Especially if you can do same day service. I don't know how long other companies take.
Sometimes it's a few weeks.
If you can do it right. Too.
Yeah.
If they could somehow show you a 6-foot plug laying on the ground, would that suffice? If you came, there's a hole and there's 6 feet.
I mean, yeah.
Stratified.
It could, I don't know how the thing they have now, like, they have to open up the thing, it's like, they can't just, core it down and then pull it out. I mean, it takes a lot to get that out of the core and, I guess, I don't know what it's called exactly, but, I don't know, I think it's okay, the way, like, the way I did it today was fine. It was very easy for the contractor, just dig a nice wide, 6 foot deep hole for me. There was a nice little ramp for me to get down in there. There was no problems. And he actually did that trial one for me last fall up at the transfer station. So it worked well. I did have one other guy that dug a really, I think it was only like a foot wide. And there was no way I was gonna get down in there to look at it, so, you just have to be kind of mindful, make sure that they're meeting the OSHA standards which is what we put, we put that in our policy, we have to meet a certain criteria for me to be able to go in and look at it.
Kind of gave her the leeway of, if you don't feel it's safe, don't do it.
Yeah, I'm not gonna go on anything I think is gonna collapse or anything like that, so.
Of course, those guys that get trapped in those construction, pits, never thought,
Right. I
of
mean.
course, I don't know what 6
At least
feet.
the backhoe's there, we can scoop her back.
So once you're at, anything below 6 feet is really when you get into that dangerous step. But 6 feet isn't, when you've got a 6 foot by 6 foot trench, it's safe. So, I mean, you'll see a little dirt come in from the top, but it's not gonna collapse.
Life is black, white, and gray,
It will, it's gonna collapse and then it's gonna be in the paper, no. No, I think it's fine. I'm fine with the 400. Like I said, we already got one today. It's our second, septic permit of the year. So I think that we might do great with it.
I see no reason to not, just do whatever, to try to stay on the board's good graces or whatever. I'll make the proposal that we increase it to 400. Motion.
All right. It's been moved by Dr. Bivey and seconded by Ms. Davenport to do the $400 proposed sanitary and soil fee. All in favor? All opposed? Motion carries. All right, I think that's any board member comments? Seeing none, any citizen comments?
Just something for board health members. I have a booklet about open meeting and open record handbook that I'll give to each of you for. We just had some modernization money that we spent out, so we wanted to get our board of health just a little education. Scott County should have reviewed these quite a while ago, but I kind of missed Michelle and missed these meetings, so I'll hand it up to you.
Awesome, thank you.
Gonna send me something. We don't.
Is it basically just like Robert's rules wrapped up in a?
It's basically from the Iowa Freedom of Information Council. They put these books together. So it's all about open meeting and open record handbook for you guys to have at your fingertips.
All right, thank you.
This is Cindy. Can you guys see on your screen that Maddie had sent in some messages? Or no? She just wanted to say, sorry, she was having trouble unmuting. It was nice to see everyone, and she's very grateful for the partnership with Hillcrest and Scott County Health Department.
All right.
Thank you.
Any other citizen comments?
Question about WIC. So it looks like an only 70% of people that could benefit from their participating or whatever. And is that communication, ignorance, embarrassment? To anybody that's got personal experience with it, your observations?
So are you talking about the handout that I had included, Dr. Bybee?
Let's see what.
Or are you talking about the farmer's market program?
I don't know if you can see it where you're at. It talks about, 41% of infants in Iowa are covered by it, 60% of eligible individuals in Iowa participate in WIC. So I guess that would be 70% of the population, but yeah, so the reason why they only 60% are participating.
Yeah, so that's what we've been struggling with, that percentage of participation has gone down. It is not just Iowa, it is a national issue that participation in the WIC program has gone down. There's some thoughts as to why that's happening. Some of it we think is they had increased food stamps. You know, and with food stamps, they don't have a specific food package that they have to purchase. So that gives some more leniency that direction. We think too, some of this younger generation coming up wants to do more things virtually, not have to walk into an office and do some appointments. So we feel that that has been some of the decrease in our participation as well. I had written in the report about the letter, support letter that the Iowa Association of WIC Coordinators was had written and sending to Senator Grassley. During COVID, when we were doing a lot of virtual appointments, our participation had increased considerably. And then once we had to open up again and people needed to start coming into the office again, that participation decreased. So what we're hoping is that as they're looking at how the program is administered, we're hoping maybe they will cause some flexibility with that in presence that the program requires. In presence appointments are really only twice in a year for most families. We try to have them doing all their kids at the same time, so they're not having to come in multiple times throughout the year. That has been streamlined considerably. I've been with WIC for 32 years and people used to have to come in monthly to be able to receive their benefits and participate in the program. So there's been a lot of streamlining, but apparently not enough yet. So I think the federal government is taking a look at how we could try and do some more streamlining to increase that participation.
Thanks.
You're welcome.
Any other comments? All right, looks like our next meeting is May 16th, 7 p.m. So there a motion to adjourn?
I'll make that motion to adjourn.
Second, all right. So it's been moved by Ms. Flagel and seconded by Dr. Bybee. Meeting adjourned. Thank you.
Thank you.
Thank you.
Thanks, Elizabeth. Thanks for admitting me into the meeting.
You're welcome. Sorry I was late with that.
No problem.
Have a good evening.
All right, you too. Thank you.
Thanks. Bye-bye.